I am Dr. Debabrata Roy, and I am very much pleased to discuss about some lifestyle modifications. Blood pressure and the blood sugar, unfortunately, are often termed as silent killers. So, the patient, may not be aware that they are having high blood pressure or high blood sugar until it is too late. However, there are some signs like you can have headache, you can have palpitations if you have very high blood pressure, you can feel warm, unusually warm. These are some of the signs that will point to high blood pressure. And if you have blood sugar, as per the classical teaching that we have, that if there is increased appetite, increased thirst, and increased urine. This is the classical triad that the blood sugar patients they have. But what is not stressed, unexplained weight loss can also be an early feature of blood sugar. So if you are not a known diabetic or dyslipidemic or hypertensive patient, you can always check it every 6 months. But if you have one of these things, it is always better to check it every 3 months. Both these high blood pressure, blood sugar, and cholesterol, they can affect many organs, starting from your eye to your foot. So you can have some disturbance in vision, you can have headache, you can have disturbed sleep, you can have increased urination, increased appetite, weight loss, increased thirst. Then you can have chest pain. This is a very important sign. That means that you might be having heart diseases. And a very important thing what we often see in our clinical practice is the swelling of your legs. That may be the harbinger of your kidney failure in such patients. Very, very important. If a patient with hypertension comes to you of swelling of both the feet, you should always check whether he is having initiation of kidney disease. These diseases, once it happens, it stays with you. That is a very important thing to understand, that it stays with you. So what happens many a times, the patient will feel that I have taken medicines, it is under control, so it's well to skip the medicines and go on what he did in the past, no restrictions, nothing. No, that's not the correct thing. Because what we are doing effectively, you need to understand, we are not curing the high blood pressure or high blood sugar or high blood cholesterol or lipids. What we are doing, we're keeping it on check. And once you withdraw your medicines, they are again going to resurface. And probably there will be a rebound phenomenon that can affect your body at a much greater intensity. So that's bad. The next thing is all drugs, unfortunately, they have side effects. So with lifestyle modifications, that is the non-pharmacological thing, if you can keep it in control to a great extent, you can bring down the dose of the drug. But I have hardly seen any patient doing well only on lifestyle medication unless it is very early, unless it is an acute event. Sometimes acute stress can produce high blood pressure, high blood sugar, and if that stress is gone, then again they come to normal. Unless such thing happens, it is basically a sustained thing that we need to understand. So we are very, very unfortunate. We are South Asians. We do have these diseases at a very early age, and because it's in our genes, we are unfortunate. But we need to be vigilant, and once these are detected, we need to understand that these are things that should be controlled. Otherwise, we may land up with a heart attack or a kidney failure or a brain stroke, some serious events like that. Eat healthy, do regular physical activity, quit smoking, and keep your blood pressure, blood lipids, and sugar under check. That will be my message. Thank you.